Oki here, and we're at the National Nursing Forum in Hobart, and I'm talking here with Sally. Sally, could you introduce yourself, please?
G'day, I'm Sally Sutherland Fraser. I run my own business, Health Education and Learning Partnerships, with a colleague, Mena Davies. We've been doing some work with Pacific nurses to improve their standards, help them write some standards of practice so that they can work more effectively and consistently. And I've just come back from Northern Pacific trip, which was very successful. A really quick turnaround to go from being in Ponape to, Hobart, which is a beautiful place, but climatically amazingly different.
Very amazingly different this week. Now, you've got a poster that you're going to talk us through. Can you talk about the work that you've been doing there?
Oh, thanks, Mary. I draw your attention to this corner, which really gives a sense of what the aims of the project have been. It's actually part two of a project, really, that came out of a request to help Pacific nurses develop practice standards. This poster is about the mentoring that we've been doing as a result of that first level of project, where we realised that having developed standards was only one part of the puzzle. The next thing was really to make sure the nurses themselves had a sense of their ownership, really, a capacity to lead within the Pacific, and to not have such a reliance to look outside the Pacific, to actually turn inwards. So it's been a fantastic opportunity to work with, initially one-on-one with one of the nurses in Solomon Islands, Neri Raddy, and it was an idea that emerged from working with her that spending time with one nurse one-on-one could actually make a difference to their confidence, their ability to manage things for themselves, and to start flourishing. And so the consequence of that, we went back a year later and worked in 3 different countries, Fiji, Vanuatu and then Kiribati, with the local nurses. The following year we took nurses from those countries, and I actually stood back and made them sort of take on that mentoring role, so that within these extra countries they felt there was a Pacific nurse they could call on when they needed some support. And having just come back from Ponape with Mena, we co-facilitated with a nurse from Samoa, Heaven, and she was fantastic, and she's an emerging nurse leader within the Pacific.
What are the barriers they face in leadership and then also in healthcare?
Oh, well, how long have we got? It's really challenging. I mean, it's hard to avoid the impact of climate change on their countries. Being in the Pacific at the time of the global meeting was kind of difficult, and also an opportunity to say, look, what can we do? What other ways can we help? I think the nurses themselves have great pride in their country and what they can do. So it's not about finding the gaps and the barriers, it's actually working with them in a positive way and saying, you guys, some of the things you do are leading the way for us. And in fact, this project is an example of that. My organisation, professional organisation, Acorn, have been inspired by the work they've done and have started to do some of the same things with practice standards and audit tools. Well, having worked with the Pacific nurses to develop their standards, we also developed audit tools so they could monitor their compliance with the standards. Within Australia, we didn't have that. So our organisation said, could you do that for us as well? And we've just completed that project as well. So now Australian nurses, I love to be able to say this, Australian nurses are doing what the Pacific nurses are doing. And that's a really fantastic thing for both, really, for us to say, look, we don't have all the answers. We've got to look outside to our neighbours. And that just brings me back in a nice way to say, what other ways can we be better global citizens in terms of improving their health outcomes for the nurses in the Pacific? And through their leadership capacity, if we can help them become better nurses and leaders, then indirectly that will improve the health outcomes for Pacific nations because of the people that they care for.
Let's talk about climate change, because you were there in a very timely fashion. So can you describe that and how you saw the impact on health and healthcare and health services?
Oh, well, look, you have to be there to really get it. You can read about it and you can understand the science and accept it. But it's not until you're there and you step out, if you go to Kiribati, you step out onto reclaimed land that's connected by a causeway that's being constantly rebuilt by, different nations. They have to accept donations to get this work done. And there is constant water egress. The hospital is on the coast. I saw the nurse unit manager standing up, wiping the sand off the windows every morning through the louvers. And now there are patients, a metre away from this kind of climate lapping away at their doors. It's ever present. And that's only one part of the environment they're working in. They have problems with supplies. Sometimes the climate is such that roofs collapse, and that opens the healthcare facility to the weather, vermin. They're things that we just wouldn't accept in this country, and yet these nurses have the strength and ability to come to work each day, accept the difficulties they've got, but continue to try and work and do the best that they can within that. I really encourage people to travel to the Pacific to see it for themselves and to ask questions, what can I possibly do to make a difference? So already I start to think about, and it sounds really pathetic to say it, but I do have to think about, can I not use plastic? Will that make a difference? I mean, I see bottles of, plastic bottles washed up far north Queensland. They've come from Solomon Islands. I think, well, maybe by working with Solomon Islands nurses, I can make those comments that I found one of your bottles on my beach in far north Queensland. And there's a reciprocal sense that, well, what can they do about that? We had no idea of the impact that we have around our environment.
Were you aware of frustration or anger or anything else about Australia's refusal to come to the table?
No, I wasn't. I think there's a great level of respect for countries' kind of sovereign views. And you can hear that, I think, the Prime Minister of Fiji, his comments really reflected a sense of respect and dignity, that this is not how we work. Why would we expect that and accept it from another country? And the nurses we work with, I would imagine it's ever present, but it doesn't come into the conversation because I think they get a sense that maybe this isn't part of the conversation for us to have yet. I feel quite uncomfortable about it. It's very hard to know how to take that line. Is it for me to apologise on behalf of policies that I think are crazy that my government might be pursuing? That's really difficult. I think you have to work one-on-one and try to make the impact that you can, and be open to seeing other people's views and try to step lightly.
Fantastic. Thank you very much, Sally.